Welcome to the Victory Education Lounge. I'm your host Maurice, and today we're diving into a fascinating and crucial topic: gender differences in insulin resistance complications. This is part 109 of our ongoing series on metabolic health. Before we begin, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this vital information. Now, insulin resistance is a condition where your body's cells don't respond effectively to insulin, resulting in high blood sugar levels. You might wonder, why should we discuss gender differences? Many people don't realize that insulin resistance can affect men and women differently. Whether you're managing insulin resistance, concerned about your metabolic health, or simply aiming to understand these gender differences, this video is for you. Today, we'll explore how insulin resistance complications can vary between genders and discuss solutions, management strategies, and prevention methods tailored to each. Well, the thing is, insulin resistance does not affect everyone equally. Men and women can experience different complications due to their unique biological makeup, whether it's heart health, fat distribution, hormonal balances, or even pregnancy-related concerns. Insulin resistance can have different implications based on your gender. Understanding these differences is crucial for effective management, prevention, and treatment strategies. And that's exactly what we're going to delve into in this video. Now let's look at 7 key areas where gender differences in insulin resistance complications become apparent. First off, women with insulin resistance often have a higher relative risk of cardiovascular disease compared to men. This gender disparity in cardiovascular risk is a pivotal point of discussion when addressing insulin resistance complications. In essence, insulin resistance can lead to higher blood sugar levels. Over time, this can result in damage to blood vessels, increasing the risk of heart disease and stroke. Women in particular have been found to carry a higher risk due to insulin resistance, posing a significant health concern. So, how do we manage this risk? A key strategy is conducting a gender-specific cardiovascular risk assessment. This means evaluating an individual's risk factors, including age, blood pressure, cholesterol levels, and lifestyle habits, with careful consideration of gender-specific nuances. For example, postmenopausal women may have a heightened risk due to changes in hormone levels that can exacerbate insulin resistance. Alongside this, tailored exercise programs can play a significant role in managing cardiovascular risk. Regular physical activity can help lower blood sugar levels, improve insulin sensitivity, and reduce heart disease risk. However, the type and intensity of exercise may need to be adjusted based on gender-specific factors, such as body composition and hormonal status. The pros? This approach can lead to a more accurate prediction of cardiovascular risk and more effective prevention strategies. The cons? It may require additional testing and a more personalized approach, which can be time-consuming and potentially more expensive. Let's consider an example. Meet Sarah, a 55-year-old woman who underwent a gender-specific cardiovascular risk assessment. Her doctor identified elevated risk factors and suggested an aggressive prevention strategy. This included changes to her diet, increased physical activity, and medication to control her blood sugar levels. As a result, Sarah was able to reduce her heart disease risk by 30% over 2 years. This is why a gender-specific cardiovascular risk assessment is crucial. It allows for the identification of those at high risk and the implementation of effective prevention strategies, ultimately helping to reduce the burden of cardiovascular disease in those with insulin resistance. Moving on, men tend to accumulate visceral fat, while women often store more subcutaneous fat, affecting insulin sensitivity differently. Simply put, visceral fat is stored around organs in the abdomen, while subcutaneous fat is found beneath the skin. Now, this distinction is important because visceral fat is particularly harmful, producing inflammatory substances that can lead to insulin resistance. But here's the catch. Even though men are more prone to visceral fat accumulation, women can also develop visceral fat, especially after menopause. So this becomes a shared concern for both genders. To manage this, gender-specific dietary approaches and targeted exercise routines can be beneficial. For instance, a diet rich in fiber and lean protein can help reduce visceral fat. Similarly, combining strength training with cardio can help manage both types of fat. Take for example John, a 50-year-old man who focused on reducing visceral fat through high-intensity interval training. His insulin sensitivity improved by 25% in just 6 months. Thus, gender-specific dietary approaches and targeted exercise routines can be highly effective. Next, let's talk about polycystic ovary syndrome, a condition specific to women that's closely linked to insulin resistance. PCOS is characterized by high levels of androgens, irregular menstrual cycles, and cysts in the ovaries. It's a common cause of infertility and is often associated with insulin resistance. Management strategies for PCOS often focus on restoring hormonal balance. This can involve adopting a low glycemic diet and considering insulin-sensitizing medications like metformin. The benefits of these approaches are that they directly address a root cause of PCOS symptoms. However, they may require long-term medication use. Consider Lisa, a 32-year-old with PCOS. She adopted a low glycemic diet and started metformin. Over the course of a year, her menstrual regularity improved, and her insulin sensitivity increased by 40%. As we can see, addressing hormonal balance is a key strategy in managing PCOS and insulin resistance. Insulin resistance can also impact testosterone levels differently in men and women. This hormonal interplay can lead to different complications in both genders. In men, insulin resistance has been linked to decreased testosterone levels. This can result in symptoms like reduced muscle mass, fatigue, and low libido. On the other hand, for women, insulin resistance often correlates with increased testosterone, which can lead to symptoms such as excess facial hair, acne, and irregular menstrual cycles. Now let's talk about potential management strategies. Regular hormone level monitoring is essential for both men and women. Blood tests can help identify any hormonal imbalances that may be contributing to insulin resistance or its symptoms. Lifestyle interventions to improve insulin sensitivity can also play a significant role. This could include regular exercise, maintaining a balanced diet, avoiding excessive alcohol consumption, and ensuring adequate sleep. The pros of these strategies are that they can improve overall hormonal balance and alleviate related symptoms. For example, a man with low testosterone might see improvements in energy levels and muscle mass, while a woman with high testosterone might see a reduction in acne or excess hair growth. However, the cons include the necessity for ongoing medical supervision. Hormone levels can fluctuate and need to be monitored regularly to ensure they stay within a healthy range. Lifestyle interventions might also require substantial changes to daily routines, which can be challenging to maintain long-term. To help illustrate this, let's consider the case of Mike, a 45-year-old man. Mike was experiencing fatigue and noticed a decrease in his muscle mass. His doctor identified that he had low testosterone levels due to insulin resistance. Mike made significant lifestyle changes, including adopting a balanced diet and regular exercise regimen. Over the course of 6 months, he was able to improve his insulin sensitivity. As a result, his testosterone levels normalized, and he saw improvements in his energy levels and muscle mass. Hence, regular hormone level monitoring and lifestyle interventions can make a significant difference. Lastly, gestational diabetes is a complication specific to pregnant women with insulin resistance. This condition is characterized by high blood sugar levels during pregnancy, impacting both mother and baby's health. It's crucial to note that gestational diabetes can increase the risk of type 2 diabetes post-pregnancy and also affect the baby's health in the long run. Now let's talk about management. The first step is preconception health optimization, which includes a balanced diet, regular exercise, and maintaining a healthy weight. This proactive approach can drastically reduce the risk of gestational diabetes. The second step is close monitoring during pregnancy. Regular checkups and glucose tests ensure that blood sugar levels are kept under control. The advantages of these strategies are clear. They can prevent complications for both mother and baby. However, they do require intensive management during pregnancy. Consider the case of Emma, a 30-year-old woman with a history of insulin resistance. By working closely with her doctor to optimize her health before conception, Emma significantly reduced her risk of gestational diabetes. Therefore, preconception health optimization and close monitoring during pregnancy are critical. Understanding these gender differences in insulin resistance complications can help in developing more effective prevention and management strategies. We've covered a lot of ground today, so let's quickly recap. Firstly, cardiovascular risk is often heightened in women with insulin resistance, with tailored exercise programs and gender-specific assessments proving beneficial. Secondly, we delved into fat distribution and how it differs between genders. Men typically accumulate more visceral fat while women store more subcutaneous fat, each affecting insulin sensitivity in unique ways. Tailoring dietary approaches and exercise routines to these differences can enhance weight management and insulin sensitivity. Next, we looked at polycystic ovary syndrome, a condition exclusive to women that's intricately linked to insulin resistance. Addressing hormonal imbalances and considering insulin-sensitizing medications when necessary can alleviate PCOS symptoms and improve insulin sensitivity. We also discussed testosterone levels, which can be lowered in men and raised in women due to insulin resistance, leading to different complications. Regular hormone level monitoring and lifestyle interventions can help restore balance and alleviate related symptoms. Lastly, we touched on gestational diabetes, a specific risk for pregnant women with insulin resistance. Preconception health optimization and close monitoring during pregnancy can prevent complications for both mother and baby. Knowledge is power, and understanding these gender differences empowers us to develop more personalized, effective approaches to managing insulin resistance and its complications. It's not just about managing symptoms, but about optimizing health and quality of life for everyone, regardless of gender. Remember, this is part 109 of our series on metabolic health. We'll be delving deeper into these topics and more in our upcoming videos, so stay tuned. Remember, understanding and addressing gender differences in insulin resistance complications can lead to more effective management and better health outcomes. By tailoring your approach to your specific needs, you're not just managing a condition, you're optimizing your overall health. Thank you for joining us in the Victory Education Lounge. Don't forget to like, subscribe, and share your thoughts in the comments. Your experiences could help others on their journey to better health. Disclaimer: the information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decisions, especially those related to insulin resistance and gender-specific health concerns, should be discussed with a licensed physician or qualified healthcare professional.